Hey everyone, this is the Unit Lab 2 for Human Communications. I'm here with my friend and um, roommate or floor mate, Kayla. She is a nurse technician at the emergency room in St. Luke's, right?
Yeah.
So basically, in class, we're talking about nonverbal communication and how it's important to use in your workplace. So my
Okay.
research question is what when exploring things like terminal illness or giving terminal illness to patients, what kind of nonverbal communication must you use in order to make them feel most comfortable and relaxed? So that's my overall research question.
Okay.
So my first question to you is, what do you think nonverbal communication is?
Nonverbal communication is more like just how like your body actions, like not exactly what you say, just like what your body does when talking to a patient.
Yeah. So in class we talk about cues, and it's kind of like wordless cues you use. The dictionary definition of nonverbal communication is communication between people, sending and receiving wordless cues. So some examples of that could be haptics, which is touch, um, kinesics, which is body language, the body language you use. So let's start with haptics. What kind of touch or consoling could you do to a patient, like um, using nonverbal communication?
Well, if they're having a hard time, like a hug is always acceptable. If they want it, if they are that friendly kind of patient and they're open to that. Or like if they need a hand to hold, like during a hard time, like that's always good too.
Okay. So as a nurse technician, you are kind of a nurse's assistant,
Right.
right?
Yeah.
So there are always nervous patients
Right.
in the emergency room, of course.
Mm-hmm.
If you're dealing with a patient who has a terminal illness, um, are you required to tell them, or do you have to use nonverbal communications to keep them more relaxed? Are you authorized to tell them, wait for the doctor?
Mm-hmm.
How does that process work?
It's not really like in my scope of practice to like tell them what their like diagnosis is. Like most
Mm-hmm.
of the time, I don't really know what the diagnosis is unless like I ask the nurse.
Mm-hmm.
But the nurse usually like talks to the patient and the doctor. The doctor usually tells them about their illness. Um, but I do have to use like nonverbal communication and verbal communication, like telling them like, oh, the nurse or like the doctor will be in with you soon, just like stuff like that.
And what kinds of body language do you use to make them feel more relaxed?
Definitely like get on their level, like they don't stand over top of them because
Mm-hmm.
they feel like overpowered.
That's a sense of dominance
Yeah.
to them.
And just talk in a normal tone. Like don't act like you want to you don't want to act concerned. Like you just
Mm-hmm.
don't want to like show that you have that concern on your face or in like your tone of voice. You also want to just be nice. Like some nurses, like they they're not the nicest people. Like you just want to be friendly at all times and like just make them feel comfortable.
Okay. And another cue for nonverbal communication is paralanguage. So the voice, you were talking about tone, you want to maintain a normal
Right.
tone when making a patient feel comfortable. Have you witnessed any from the nurses you observe?
Mm-hmm.
What kinds of things do you learn through verbal and nonverbal communication through them?
Like I said, like they like to not show dominance over their patients. They like to just be on like the same level and
Mm-hmm.
just like make good eye contact, have that friendly tone in your voice and like show that they're just there for you, and then non verbally like just explain things. And nurses, they have to like tell them exactly like what they have medically, but then they explain it in like simple terms so they can understand. So that's a huge like verbal communication type thing.
So not only do you and your nurses have to use nonverbal communications, but do patients also use nonverbal communications, or give you cues to how they're feeling? Like,
Yeah.
Could you give examples of how a patient could, if how they're feeling or what they need?
Right. Like nonverbal communication by a patient, you can always see it in their facial expression.
Mm-hmm.
Like if they're in pain, you can see it. Also, just like how they're positioned, like in the bed. Like if they're crawled up in a ball, like does their stomach hurt? Like what's going on? But they do. Some patients don't communicate verbally. Like they just have a hard time like explaining like what's going on with them. So like you have, as a nurse or as like a tech, as what I do, like I have to like ask them a lot of questions like to just get it out of them because they don't know how to communicate verbally about how they're feeling.
Yeah. How have you had to, if a patient's unable to speak to you, is there any examples you can give that happened to you in your job where you had to observe their body language, their kinesics, or what you had to do with touch to like console them? Could you give any examples with that?
Well, like language barriers, would that be like one of them? Are you
Yeah.
talking about? Well, we have like certain phones, like if there is a language barrier and we can't communicate with them verbally, if they don't speak English, we have types of phones that they give, that we give them one, and then we listen to the other one, and we listen to like a translator.
Oh, wow.
So
that's all right. Well, thank you. This has been Kayla, and hopefully you have a better understanding of nonverbal communication through cues and how you could tell, basically from a medical point of view, which is very important, taking care of patients in the hospital. That's a very big thing to deal with because that's people's lives you're dealing with, and that's, if someone's unable to communicate to you, you need to use things like nonverbal communication to communicate to patients and patients to tell you what's going on.
Yes.
So thank you very much.
You're welcome.
Thanks.